Education is central to any kind of meaningful development, and I think that's true of whether we look at it as a species or a country or a village or a town or a family. Education is key to that, and I think a lot of us learn. I learned this actually not so much in medical school but in graduate school, that the girls' education is about the best investment we can make in order to promote the development goals that we all share. Over the past 25 years, I've seen a lot of positive developments in healthcare and education. And certainly we've seen some setbacks as well, but a lot of positive developments. Some of them I learned willy-nilly. For example, in Haiti, where what struck me as a physician in training was the lack of medical care. I also learned, of course, that by investing in education, you improve health status quite directly. And one of the most positive things I've seen in many years of working there is just how impressive the return can be when you spend 25 years in the same area, making sure that people are getting basic health care and education, not as something that they have to scramble for. Every family has to scramble for on its own, but rather as a basic safety net of services. In a lot of very poor societies, parents are committed to educating their children. And Haiti is a very complex society, as is true of any society. But if you look at the numbers, you'll see that families living in poverty are willing to invest very large fractions of all their disposable income into education. When girls aren't educated, that means that eventually, by and large, that mothers won't be educated. And when mothers aren't educated, it means they often live in poverty. And when they live in poverty, their children are vulnerable to all sorts of illnesses, including those that could have easily been prevented. So the downside of not having girls' education is enormous. And I would say we don't even have the proper metrics to assess what we've lost by failing to invest equitably in girls' education. We don't even have the measurements yet. In Haiti, since the earthquake, I've seen so much suffering. Of course, this is everybody who works there, but some of it that just wasn't necessary. Like every case of tetanus, many of them fatal, means that someone didn't have a vaccination, a very simple and inexpensive vaccination. And is that the fault of young women who are not well trained and go to school? No, it's part of a system that doesn't make it easy for young people to access health care, preventive services, but also, again, girls' education. Because we know already that the children most likely to receive the benefits, public health benefits of these interventions are those whose mothers have gone through some formal schooling, a lot of it. I'll give you three justifications for girls' education. And they'll all add to the same thing, so I'm happy to say whichever one might resonate with whatever audience. But say justification number one for girls' education. You'll never break the cycle of poverty and disease without educating girls. It won't happen. So that's a sort of development justification for girls' education. Number two, you won't see economic growth unless girls are educated and you have all the resources that businesswomen or other leaders could bring to you won't have that unless you invest in girls' education. So that's a growth justification. And then here's the one that I think we forget too often, which is the rights-based argument. And the reason we forget it is it's very difficult to lend real implementation teeth to rights arguments. So if we say that there should be a right to education, and certainly a right to primary education, in every society where that has been decided, it's been a struggle. In other words, the result of a struggle is to have these basic rights. But I would say that whether you look at rights, growth, or economic development with equity, you still need to invest in girls' education. And so it should be, again, as Americans say, a no-brainer that we're not going to move forward whether as a series of nations or a global community, we're not going to move forward until we have really substantial investments in girls' education.